Hi everybody, my name is Elyse Carr. I'm doing a webinar today on the BeWell Model. I'm Program Manager with HealthyWorkers. Just to talk you through a little bit about what we're going to talk about today, I'll do a bit of an introduction of myself, talk a little bit about well-being, introduce the concept of the mental health continuum. I'll bring in a bit of information about our BeWell model, and then I'll give you some practical tips of how you can implement improving well-being in the workplace. Okay? So who am I and why am I telling you about wellbeing? Well, as I said, my name is Elyse Carr. I'm from Australia. My career has really been built around occupational health and safety. I've focused in psychological safety for the last 4 or 5 years. And what that means is really about how do you prevent stress, prevent suicide, and improve wellbeing in the workplace. I previously worked for the Australian government, so really my job was about building capacity in this space. So how can you do this? In Australia, it's a fantastic country where mental health is taken quite seriously in the workplace. It's legislative compliance to provide a mentally healthy and safe workspace. So to be able to do that, it was really important for us to have some clear project management. I really was excited that when I had the opportunity to come to the EU to bring my knowledge, even though it's not legislative here, I can actually explain how we do it in our country, how other places are doing it around the world, and some best practice approaches. So to get us onto that, I think it's really great if we start with what is well-being. On the screen at the moment, you can see this is the World Health Organization definition. It's a bit wordy. Essentially, what people feel like well-being means is it means you're happy. It means you're healthy. But really what it means is being not only physically healthy, but mentally healthy. It means that you contribute to your community. You have good, positive relationships. Part of this is eating well and exercising. And really what's on the screen sums it up. You know, you can realize your own potential. You can cope with normal stress, work productively, and contribute to the community. So there's some amazing work being done in this space, and the fact that we have a definition is really great for us to be able to work to from a workplace perspective. So I'd like to introduce the mental health continuum. The idea is that on any day you can come into work, or at any time you find yourself somewhere on this continuum, all the way from in crisis to thriving. When you're in crisis, you can be mentally unwell or mentally injured. It means you could be struggling with depression, anxiety, or burnout and stress. And there are some core, well, when we talk about it from a workplace perspective, there are some core business functions that help you along this scale. So if you find yourself in crisis, and say you're suffering from a burnout, you will have processes such as return to work, or in the Netherlands, we've got things like ARBO that help you come off of that burnout and become, get you working up that continuum. If you move up a little bit further to struggling, you see that we've got processes in place that prevent this, such as, what sort of HR processes you've got. How can people management help you move further up that scale? You've got occupational health and safety, which will put controls in place to prevent the risk of you going down to the burnout phase. And then we get to fine. And the expectation previously was that if you're coming into work and you're fine, that's perfect. That's really what we want, You're fine, the business is fine, what more can we ask for? But new ways of working and new generations and the way we're moving forward, we cope with new stresses at work, we cope with new stresses in life, and it's not really enough. The expectation from a lot of the new generation, but also just as we change the ways we work, is that the workplace is going to help me thrive. It's going to help me be well. It's going to help me with my own personal goals. And so this is when you see new positions coming up, such as chief happiness officers and wellbeing managers. And their role is really to take you from that fine phase up to thriving and see how you can achieve that and give you the platform to achieve that. When we talk about this, we say it is really good for business. When you move up into this happy, healthy, well and thriving phase, as an individual, you also move there as an organisation. And this is when we get into culture talk and about positive business culture and how it equals positive business outcomes. So there's a lot of statistics around this. I'm not going to go through them today because it is a short talk. But basically, we have increased productivity, reduce absenteeism, reduce staff turnover, reduce injuries and accidents. Basically the takeaway is that positive business culture results in positive business outcomes. So it's worth the business to take you from being fine to thriving. Excuse me for a second. So from an individual perspective, mental health can have a serious effect on the individual, not only physically, mentally, emotionally, and behaviorally. It can change a person completely. And it can spread through an organization as well in a negative way. You have decreased morale, you have issues within teams, and it's just the complete opposite to the positive business outcomes that I previously mentioned. So I think that takes us on to our next slide, which is how can you reduce work-related stress and improve well-being? Essentially, you've got to understand that there are 3 different domains where this can be done and where this is achieved. So we have environmentally, individually, and organizationally. So at HealthyWorkers, we've called them building, body, and business. And so essentially they are domains of areas where it can be improved or improved or decreased. So you can improve work-related stress, reduce work-related stress and improve well-being. In the building, if we talk about the environmental factors, we're talking about the physical space. So how does the building affect somebody's well-being? This is everything from ergonomics, you've got lighting, you've got temperature, you've got facilities, services, infrastructure. And this is really the area that I think we'll be talking a little bit about today. We do have good benchmarks in this space, but it is really important about detecting the culture and seeing how the culture responds to that building as well. So individually, which is the body domain, is all about the individual and the person. So who that person is and how they choose to live their life. So are they somebody who chooses to exercise? How is their nutrition? Do they choose to smoke and drink? Are they active in their community? Do they have good relationships and savings, and how's their finances? How do they work in their household? All of these kinds of things are who a person is. And that can contribute to work-related stress. So the third one is organizationally, which is business. This is your HR processes and how your business is run. Essentially, this is what we were calling culture. So what are your business values, and is well-being a part of that? Do you have training in place? Do you have policies that say you are a mentally well, a mentally healthy workplace? And it's about how people treat each other, those unwritten ground rules. So the important thing to go forward from here is about not only understanding that there are these 3 domains, but how they interrelate and where you have control. And this is where we've made our BeWell model. So I'll talk you through it. It can be a bit overwhelming to look at in the first instance. But basically, as you can see here, we've got our 3 domains, the building, business, and body, which I've just spoken through. Excuse me. And basically, we have factors within each domain, which is kind of what I was talking about. So in the building, it's things like lighting, ergonomics, your temperature, facilities, the kitchen, the coffee, the bathrooms, all these kinds of things. And if you optimize the factors within each domain, you end up with a different result. So optimizing the building results in a smart and healthy building. Optimizing the body, so the individual, all those things about nutrition, smoking, exercise, you result in well-being. If you optimize the business, you result in a positive business culture, which is the sort of thing I've been talking about so far. So if I just go from here, the end goal here is always employee well-being, and that is something that at HealthyWorkers we strive for, and we believe organizations should strive for too. The key takeaway is that well-being impacts and these things, everything is so interrelated in this that the individual is the key thing that you need to influence. So how can you make somebody well? You cannot tell them that they have to go to bed at a certain time, and you cannot tell them that they have to eat certain foods or they have to exercise. It's not your right, and it never will be. But you can influence their well-being, and you can influence these factors by taking the other 2 domains, the building and the business, as a platform. So you have an opportunity in the workplace to see how is it that your job can play on these factors, change them so that you can positively influence the individual? If you think about the building, for example, facilities management, building management, real estate, design, all these sorts of roles have a role to play in influencing those factors. From the business perspective, you've got positions like HR, occupational health and safety, the board and the leadership team, especially, you know, the CEO who's standing up for management. All these people also have a role to play in the business side of things. And it's about how you can use your role to influence those factors to have a positive influence on the individual. So as an example, I take a quite simple example like sleep. Say you ask your employees how they're feeling, what is it that they find is the biggest struggle in their life when it comes to well-being, and they say, I'm not sleeping well. It's very easy for you to do two things. You can treat this, the symptom, which is sleep. Sleep is the outcome of feeling stress. You're not sleeping well because they're stressed or they're not well. But you also have to treat the root cause. So you have to ask the questions, why are you not sleeping well? If you think about it from a business perspective, you know, do we have a work-life balance issue? Does our culture allow emails up at all hours of the night? And is the culture that you will respond to those emails and phone calls? Do we have things like flexible working arrangements? Or do we have things like conflict within our teams? And all of these things can cause stress on the individual, which results in things like poor sleep. From a building perspective, if you think about if you've got a position where you can make changes to the building, such as facilities or building management, or even just as a business owner, you can ask the questions of, do we actually provide somewhere for people to relax? You know, some companies have things like sleep pods, but you know, further to that, what times is your building open? Is it available for things like flexible working? You know, is the location really, really far from where a lot of your employees live? Do they have to travel long hours getting to and from work? Is there security available when, say, it's dark outside? And, you know, what kind of things can you put in place within the building that will enable you to treat this symptom of stress, as well as the root cause, of course? So let's see. From a HealthyWorkers perspective, our product is really focused on two sides of this. It's about taking the benchmark data for things like the building and the business, like, you know, if we say building, what is the temperature that the building is supposed to be? What is a perfect office design? What is a perfect humidity? Taking that sort of cookie cutter image of a perfect office, but combining it with the employee experience, because there is no perfect office for every culture. Every business is different and the people within that business are different. So it's great to start with the bones of what is working and what is best practice, but then being able to give the employees the opportunity to fine tune that to their culture. So giving them a tool to provide feedback. And then we also give the employer and the facilities management and the building management the dashboard to be able to see how those two things are interacting. So even though it could say, for example, simple example, the temperature is perfect at all hours. You have a great office, great temperature. But what if your employees don't feel that way? You know, they say it's constantly stuffy in here. I don't like it. It doesn't smell that well. They can provide that sort of information anonymously back, and they can vote on that as well, which means changes can be made and tailored, and then we can get that full feedback loop saying, yes, you've changed it and it's fantastic. It's exactly what we want. It is a very simple example of how our product works, but I think for this presentation, it's important to keep things kind of simple. So making these sorts of things stick. How can you make wellbeing stick in your office? The first thing I would say is you've got to build your team. You know, you need a wellbeing team. It's about finding how you and your role can have an impact on the individual, as I said, through the building or the business, and teaming up with the other people that also can do this and fill the gaps that you may not be able to fill. So people like your HR manager, your facilities manager, someone from the leadership team, having occupational health and safety on board if you've got a return to work officer, but also making sure you've got your employees on board. You need some representation from how they feel as well. Making sure that team's all together and tackling the issues that you find as a team. The second one is combining the benchmarks and perception. this is what I was just talking about, saying, you know, there is no cookie cutter workplace. You cannot have the perfect workplace for every kind of culture. It's important to understand what is best practice, you know, say ergonomics or anything, you know, what is the best way that best things we can provide for our employee base when it comes to health and well-being, but also listening to them and what they need to perform their jobs well, or to do the work that they need to do in the way that they want to do it, and giving them some control and autonomy over this process as well. Tackle the problem at the root and treat the symptoms. So this is sort of what I was talking about when I was saying sleep. You know, we can tackle sleep from a really symptomatic point of view. You can give people sleep seminars. You can even give them sleep robots these days, sleep pods, and you can do all this through the workplace. But it's important to tackle the root cause issue. Why are people tired at work? And you need to ask that question as well and find out what are the sort of business and building issues that are contributing to that. So it's important to work on both. You get quick wins and you get real culture change in the long run. And the last thing is actually the first thing you should do. So commitment is the first step. Having a commitment to well-being within your organization is really important. As a leader or, you know, as an owner of a building, you should be able to stand up and say, we care. We care about your well-being, and we want to give you a platform, a place where you can go from being fine to thriving. And these are the things that we're going to do about it. So that is it from me. I think I've wrapped it up quite in a nutshell, but I'm happy to take some questions if we've got some. I just have to, here we go. Okay, any questions? Okay, so how do you define the boundaries between optimization of employee regarding well-being? Many employees may not want the employer to interfere. This is, of course, the case. You know, there is a very big distinction between what is work and what is home. But the thing that we want to communicate is that you can't, you know, if you have a broken leg, you don't get to have a broken leg at home and a fine leg at work. So if you're feeling mentally unwell, or you're feeling just a little stressed in your personal life, it can also contribute and have an impact on the workplace. So it's just important to ask the questions and to be open to providing resources and assistance if required. And if not, that's completely fine as well. But at least you know that you've given the opportunity. Okay, so what are some tips to start wellbeing at work when it's not a company-wide effort yet? So we would say that this is really starting a bottom-up initiative. So top-down is always when the leadership team stands up in front of everyone at a quarterly meeting and says, yes, we're going to do this. This is fantastic. We love wellbeing and we're committed to it. But when you've really got to start from the root at the, you know, the employee base, it's important to sort of find other people within the organization that are feeling like you as well and want to actually make change. And there are things that you can do as a team yourselves to improve well-being. And it's small initiatives, you know, it's things like going for a lunchtime walk, or having a, you know, healthy Wednesday eating lunch, or, you know, there's so many little small steps you can take to improve well-being for yourself and for your colleagues. And I think that's really when you want to start looking at those body factors rather than the business factors, because you may not have control over those. So things like drawing attention to things like mental health and mental illness and reducing stigma, but also getting involved in your community and doing things like volunteering, addressing nutrition and sleep and exercise, and talking with your colleagues, asking, are you okay? How are your relationships? How is life going? And I think that that's sort of a small step you can take to reduce the stigma and improve well-being at work. What role technologies can play in achieving desired level of well-being? So I think that this is a huge area that we're working in at the moment. You know, I think for well-being, tech startups are going through the roof. Everyone, it's a hot topic and everyone wants to really jump on board. I think it's important when you're looking at technologies to focus on the ones that are really addressing sort of more of those root cause issues that I talked about, rather than focusing purely on the surface layer. Like, it's all very well and good to offer your employees yoga classes and fruit boxes and things like this, but no amount of fruit boxes and yoga classes are going to change cultural issues. So understanding that there are technologies in place and apps in place and a lot of things that help you from an individual perspective, or help your mindfulness, but making sure that whatever technology you're looking for, or whatever dashboard you're looking for, assistance from even a HR perspective, it's actually going to look for what are the causes to stress within your culture at work, and what are the causes to burnout and absenteeism and high staff turnover, and making sure that whatever technology you choose is really going to help that issue. Okay, I think we have time for probably 2 more. How could I get a sense of health of my company? I feel that we have a friendly culture in my office, but our ways of working are very informal and give space to a lot of stress and arguments. Okay, so it sounds like in this situation, you're looking for some real framework and structure to well-being or to people management within an organization. And that's the thing, sometimes when cultures work, you don't question what sort of processes you have in place because things are just going well and there's no worries. But it's really important to have these sort of structures and processes in place so that you can get those clean feedback loops, so that when something does go wrong, you have the opportunity to report and improve. And that's a full cycle. You really need to have the opportunities to do those. Getting a sense of the health of the company, I think the first step is always doing a survey, isn't it? We have these employee opinion surveys that we do every year, but sometimes they do forget to adopt well-being into the questions. So I think a good step initially is to just reach out to an employee opinion survey provider and ensure that you do have a section on well-being that includes things like conflict within teams and relationships within teams, and how people, if they do feel stressed, and how often they feel stressed, and if this stress is work-related or not. So I think asking those right questions to the provider of your surveys is a great first step in this case. How much importance do you put on noise disruption as a cause of reduced productivity, increased stress in an open plan scenario? And how do you start or approach this as an issue? So noise is actually a big topic at the moment, and there's a constant battle between open plan and closed plan offices and which is better. I think that this will be an ongoing argument for the next couple of decades. There's always studies coming out that are pro and con. So whatever it is that your office is and whatever works for your office, that's fine. I'm happy either way. But in terms of the noise disruption and how that reduces productivity, it can be a lot. I read the other day that if you are distracted from your task, even for a moment, say your phone buzzes or someone yells across the room, it can take up to 25 minutes to get back on course where you were with your thought process when you're in the middle of your work. So noise is a serious problem. I think the best way that you can approach this issue is about providing different areas for your employees to work if they really do need to focus and have a quiet space. There are a number of different things you can implement. Things like we have a partner Nook Pod. You can get a Nook Pod, or you can get a quiet pod, which is a soundproof pod. But even having the opportunity to leave the office, do you have Wi-Fi? Do you have equipment that enables people to leave and walk out and sit in peace for a bit and do their work somewhere different? So we call this activity-based working. So you can do a bit of research on it. There's a lot of information out there. But other than that, I think there's a lot of acoustic interventions if you want people at their desks to be more quiet as well. Okay, and I think that might be it, guys. We might wrap up. So unless there's one last question, I think we are all good. Okay.
Okay.
Yeah, if you do have any more questions or anything else, I'm sure my contact details will be provided through to you. Otherwise, you can look me up on LinkedIn. I'm happy to discuss anything that I've discussed today, or if you have any further questions.